respected.
Sir,
Yes, madam.
so uh, good afternoon to everyone, to all the participants. Welcome back to ECO session. So today in this platform, we have a very non-eminent speakers with us, Mr. Rajesh William Gaikwad. Sir is an assistant professor, Department of Mental Health Nursing from Bharati Vidyapit College of Nursing, Sangli. Sir has done his MSc Nursing in the year 2017, PB BSc Nursing in the year 1996, and General Nursing in the year 1992. And Sir has a total experience 8 years. Sir has attended various workshop conference, and Sir has been the speakers in various workshop conference seminars. So I hand over the my platform to you, sir. So over to you, sir.
Yes, madam. We'll start. Good afternoon, all respected members, all my dear colleagues, my friends. And today my topic is on coping and problem solving. So we'll start with it.
Sir, we cannot see your slide. Your slide is not visible, sir.
Yeah, just a minute, ma'am. Is it visible?
Yes,
Hello,
yes, sir. You can continue.
Yeah.
Yes, yes, it's visible, sir.
Yeah.
Sir, your slide is visible. You can continue it, sir.
Yeah, I'm just trying to forward it.
Okay, okay, sir.
Is it visible, ma'am?
Visible.
Yeah.
Yes, sir.
So, coping in today's fast world, we always hear this word that we have to cope with so many things. We have to get up early in the morning and we have to plan our schedule, and it is a very fast-paced world. Uh, One thing what everybody is experiencing is the stress of everyday life, professional stress, personal stress within the interpersonal relationships. So in psychology, coping is expending conscious effort to solve the personal and interpersonal problems and seeking to master, minimize, or tolerate stress or conflict. So it is coming up with the terms so that we can say that the person is mentally healthy. When we say the person is mentally healthy, then the person is able to cope with the daily stresses of life. And so for this, in psychology and psychiatry, certain mechanisms are commonly used like coping strategies or coping skills. So if we see what are the types of coping strategies, it is first one is the appraisal focus. It is directed towards challenging our own assumptions. Adaptive cognitive occurs when the person modifies the way they think. For example, we say that no, I am not able to do such thing. It is very difficult for me. Employing denial or distancing oneself from the problem. People may alter the way they think about a problem by altering their goals and values, such as by seeing the humor in a situation. Now, some have suggested that humor may play a greater role as a stress moderator among women than men. For example, if we are having some test or some exam, it is apparent that we have to face that test or we have to give that examination. But we may laugh and say that no, no, I'll give this test, but for a time being I'll relax, and because this act as a stress moderate, and then I will study and give the stress. Now the thing is that it is not gender biased, but among women it is more that they use the humor as a stress moderator than men. Now, second type of coping strategy what we can use is problem focused, directed towards reducing or eliminating a stressor. Now, a stressor, as we know that anything which causes stress is called as a stressor. And stress may be of two types, eustress and distress. And eliminating the stressor completely. For example, if we are advised by the physician to go for daily jogging, and when we start thinking that how to wake up and how to go for the job, but when we say that no, no, jogging is good, it is healthy for me, we are eliminating the stressor completely and using adaptive behavior. People using problem focused strategies try to deal with the cause of the problem. What is the main cause? The root cause of the problem. They do this by finding out information on the problem and learning new skills to manage the problem. Problem focused coping is aimed at changing or eliminating the source of stress. The three problem focused coping strategies identified by Hoffman and Lazarus are taking control, information seeking, and evaluating the pros and cons of the problem. For example, what we have seen now, for example, getting up early in the morning and going for jogging, evaluating the pros, it is uh, good for health, it leads to a healthy lifestyle. But considering the cons, we can say that no, no, our sleep doesn't get completed. We don't get a complete sleep, we have to wake up early. Now, nowadays it is happening more because most of the people they are on the mobiles, late night watching web series and watching the web programs and all, watching the serials. So they get a incomplete sleep. But still, then they have to get up and go for jogging. So the incomplete sleep is a form of the jogging program. Then third one is emotion focused. It is directed towards changing our own emotional reaction. Now, releasing the pent up emotions, the emotions which are lying deep down in our subconscious mind. Now, as Sigmund Freud had said, we have a conscious mind, we have a pre-conscious mind, and an unconscious mind. So, the emotions which are down there, if we pent up, if we release it, we feel relaxed. Distracting oneself, managing hostile feelings, meditating. Meditating is the important way of reducing stress or using systematic relaxation procedures like progressive muscle relaxation procedure. Emotion focused coping is oriented towards managing the emotions that accompany the perception of stress. So, emotion. Now, what is emotion? Emotion is a strong feeling which brings out the desired effect. It is a strong feeling, emotion. So, if we are, it is oriented towards managing the emotions. Now, we say that a certain person is very emotional because immediately they show their emotions out. So, emotion focused coping is oriented towards managing the emotions that accompany the perception of stress. Now, there are five emotion focused coping strategies. First is one is disclaiming, second one is escaping or avoiding the stress, Third one is accepting responsibility or taking the blame on our own. Fourth one is exercising self-control. Now, if we get a strong emotion of eating something which is very mouth-watering to our tongue, but if we exercise self-control, we are able to use the coping strategy of emotion focus and positive reappraisal. What positive, what the pro we can get from it, that we have to do. Now, what is the focus of coping mechanism? Why we should use coping mechanism? The focus of coping mechanism, this coping mechanism, is to change the meaning of the stressor or transfer the attention away from it. For example, reappraising tries to find out a more positive meaning of the cause of stress in order to reduce the emotional component of the stressor. Avoidance of the emotional distress. Now, distress, we call it as a negative stress, will distract us from the negative feelings associated with the stressor. For example, emotion focused coping is well suited for stressors that seem uncontrollable. Example, a terminal illness diagnosis or a loss of a loved one. We are not able to forget that we have lost our loved one. So it is in this we can use this coping mechanism. Now, some coping mechanisms of emotion focused coping, such as distancing or avoidance, can have elevating outcomes for a short period of time but can be detrimental when used over as an extended period. Positive emotion focused mechanisms such as seeking social support. Now, there are many social groups, many NGOs which offer social support. For example, if an alcoholic he wants to have a social support, he can go to the NGO called as the Alcoholic Anonymous, and positive reappraisals are associated with the beneficial outcomes. The outcomes or the results will always be beneficial to the person. Now, which type is more out of these three? Which type is more useful? Typically, people use a mixture of all these three types of coping strategies and coping skills will usually change over time. Coping skills done at a period of time will change at the next period of time. All these methods can prove useful, but some claim that using problem-focused coping strategies will adjust better to life. Instead of using emotional, if we use the problem-focused coping strategies, it will adjust better to our life. Now, problem-focused versus emotion-focused. Problem-focused coping mechanisms may allow an individual greater perceived control over their problem. What it does, problem, when we solve the root cause, we are there is no need to go to the emotion focused, whereas emotion focused coping may sometimes lead to a reduction in perceived control and it will become a maladaptive coping. For example, if a couple or a husband is doubting his wife, he may take the maladaptive coping of drinking alcohol. But it is not a adaptive coping or a positive coping because alcohol itself will lead to many other stresses and maladaptive coping. Now, positive techniques. What positive techniques we can use for such as adaptive coping or constructive coping? First one is proactive coping. Anticipation is when one reduces the stress of some difficult challenge by anticipating what it will be like and prepared for how one is going to cope with it. Means just we have to analyze the situation and anticipate it. Then social coping such as seeking social support from others like a counselor or a social worker, meaning focused coping in which the person concentrates on deriving meaning from the stressful experience. Yet another way of coping is avoiding the thoughts or circumstances that cause stress. We have to just keep on avoiding. We have to divert our attention and our thoughts to something else. Now, adequate nutrition, exercise, sleep contribute to stress management, as do physical fitness and relaxation techniques such as what I had told you earlier, such as PMS, that is progressive muscle relaxation. Now, what is one of the most positive methods? One of the most positive methods people use to cope with painful situation is humor, laughing,
Sir,
making jokes.
sir, Rajesh, sir, your slide is not moving. It is on the first slide only.
Sorry, madam.
Slide. You are still on the first slide, sir.
Oh, just give me 1 minute.
Oh, sure, sir.
Is it visible, ma'am?
So yes, yes, you can continue, sir.
Yeah. One of the most positive methods people use to cope with painful situation is humor, that is laughing, cracking jokes. You feel things to the full, but you master them by turning it all into pleasure and fun. Now, while dealing with stress, it is important to deal with our physical, mental, and social well being. Physically, one should maintain one health and learning to relax if one finds oneself under stress. Mentally, it is important to think about positive thoughts and value oneself, demonstrate good time management, plan and think ahead, and express emotions. Socially, we should be able to communicate with people and seek new activities. By following these simple strategies, one will have an easier time responding to all the stresses in our own life. Now, negative techniques, that is maladaptive coping or non-coping, is dissociation. It is the ability of the mind to separate and compart- compartmentalize thoughts, memories, and emotions. This is now often associated with post-traumatic stress syndrome. Post-traumatic stress syndrome, as we all know, that due to any loss, any accident, what stress we experience afterwards, it is called as the post-traumatic stress syndrome. Now, sensitization, when the person seeks to learn about, rehearse, and or anticipate fearful events in a protective effort to prevent these effects from occurring in the first place. Then safety behaviors are demonstrated when individuals with anxiety disorders come to rely on something or someone as a means of coping with their excessive anxiety. Anxious avoidance is when a person avoids anxiety provoking situations by all means, and this is the most common strategy. Escaping is closely related to avoidance. This technique is often demonstrated by people who experience panic attacks or have phobias. Now, phobias, as we all know, it is an irrational fear, and these people want to flee the situation at the first sign of anxiety. Now, historical psychoanalytic theory, Karen Horney in the 1940s the German Freudian psychoanalyst developed a mature theory in which individuals cope with anxiety produced by feeling unsafe, unloved, and undervalued by disowning their spontaneous feeling and developing the elaborate strategies of defense. Karen Horney defined four so-called coping strategies to define the interpersonal relations, once describing psychologically healthy individuals, the other describing neurotic states. Neurotic is a person who is affected by neurosis, who is overly anxious and fearful about a thing. The healthy strategy she termed is moving with, is that which psychologically healthy people develop relationships. It involves compromise. In order to move, there must be communication, agreement, disagreement, compromise, and decision. The other three strategies she described was moving towards, moving against, and moving away, represented a neurotic, unhealthy strategies people utilize in order to protect themselves. Horney investigated these patterns of neurotic needs such as compulsive attachments. Everyone needs these things, but the neurotics need them more than the normal person. The neurotics might need this more because of the difficulties within their lives. If the neurotic does not experience these needs, she or he will experience anxiety. Now, the 10 needs of a neurotic person. Now, a neurotic person we can call who is not having a less impactful, who is not a completely a psychotic, but who has not lost his judgment and ability to think, but is having some fear or phobia. The 10 needs are affection and approval, the need to please others and be liked, a partner who will take over one's life based on the idea that love will solve all of one's problems. Restrictions. Third one is restrictions of one's life to narrow borders, to be undemanding, satisfied with little, unconspicuous, and to simplify one's life. Power for control over others, for facade of omnipotence, caused by a desperate desire to strength and dominance, exploitation of others to get the better of them, social recognition or prestige, caused by an abnormal concern for appearances and popularity, personal admiration, personal achievement, self-sufficiency and independence, perfection and unassailability, a desire to be perfect and fear of being flawed. These are the 10 needs of a neurotic. Now, in moving towards, in compliance, also known as moving toward or the self-efficacy solution, the individual moves towards those perceived as a threat to avoid retribution and getting hurt.
Sir,
Yes,
आपका slide still on the same one what you have explained previous sir. Slide share on कीजिए sir.
slide.
शेयर में शेयर करके ऑप्शन है नीचे सर, उसमें क्लिक करके स्लाइड शेयर कीजिए. पार्टिसिपेंट की जगह पे नीचे टास्क बार में सर शेयर स्क्रीन करके एक ऑप्शन है, उसमें क्लिक करके आप.
अभी आ रहे हैं.
नहीं नहीं सर, नो सर, आपका स्लाइड वंस द पॉजिटिव मेथड पीपल यूज टू कॉप विद पेनफुल सिचुएशन, ये स्लाइड पे है आपका. स्लाइड नंबर 12 में है, सिर्फ स्लाइड नंबर 12 में है सर. अच्छा हाँ, नाउ कमिंग टू आपका नेक्स्ट स्लाइड में जा रहे हैं. ओके सर, यू कैन कंटिन्यू सर.
Moving away.
Yes.
Yeah, in withdrawal, also known as moving away or the resigning solution, individuals distance themselves from anyone perceived as a threat to avoid getting hurt. Now, this is the mouse hole attitude. Uh, Mouse hole attitude, as we can see, that it is the security of unobtrusiveness. The argument is, if I do not let anyone close to me, I won't get hurt. Now, the mouse, as we see, when we try to go and beat it, it will go and hide in the hole. The same happens with the humans also. They say that they will not get close to anyone. They will not get close to anyone. So, if they do not let anybody close to them, they will not get hurt. A neurotic, according to the horny, desires to be distanced because of being abused. If they can be extreme introvert, no one will ever develop a relationship with them. Means they are socially withdrawing. And if there is and if there is no one around, nobody can hurt them. These moving away people fight personality, so they often come across as cold or shallow. These people usually they will not mix with anybody. This strategy they will use. They emotionally remove themselves from the society. Included in this strategy are the neurotic needs of 3, 9, and 10. What all 10 needs were seen earlier. Now, moving against. In aggression, also known as moving against, is or the expansive solution. The individual threatens those perceived as a threat to avoid getting hurt. Now, children might react to parental indifferences by displaying anger or hostility. This strategy includes the neurotic needs 4, 5, 6, 7, and 8. Gender differences in coping strategies are the ways in which men and women differ in managing psychological stress. There is evidence that males often develop stress due to their careers, whereas females often encounter stress due to issues in their interpersonal relationships. Maybe due to some social insecurity or internal insecurity, they might develop this stress due to issues in interpersonal relationships. In general, such differences as exist indicate that women tend to employ emotion focused coping and tend and befriend response to stress, whereas men tend to use problem focused coping and the fight or flight response because of the societal standards encourage men to be more individualistic while women are often expected to be more interpersonal. Now, physiological basis, hormones, as we know, hormones also called as the ductless glands. Hormones also play a part in the stress management. Now, an important stress hormone, cortisol, was found to be elevated in males during stressful situations, while in females, however, cortisol levels were decreased in stressful situations and instead an increase in limbic activity was discovered. As we have studied the neuropsychobiology, limbic system, it is also called as the emotional brain, the mood brain. There was increase in the limbic activity in the females. Many researchers believe that these results underlie the reasons why men administer a fight off reaction to stress, whereas females have a tend and different reaction. The fight or flight response activates the sympathetic nervous system in the form of epinephrine. Conversely, the tend and befriend reaction refers to the tendency of women to protect their offspring and their relatives. Although these two reactions support genetic basis to differences in behavior, one should not assume that in general females cannot implement fight or fight or flight behavior, or males cannot implement the tend and befriend behavior. It can be mixed. The two reactions are not specific to a specific gender. Now, problem solving. Now, as we have seen all these strategies, what problem solving approaches we can try to implement. Now, in problem solving solutions, possible solutions are carefully evaluated and one of them is then chosen for implementation. The situation is carefully monitored over time to ensure the initial and continued effectiveness of the solution. Therefore, the problem solving for one situation contributes to the nurse's knowledge for problem solving in other similar situations. Now here if we see the diagram or if you see the image, first its problem solving process goes in problem definition, problem analysis, then generating the possible solutions, then analyzing whatever solutions we have found out, implementing the solution, and then evaluating and revision if the problem is solved. Now, in problem definition, in this first step, there is a need to write down what exactly the problem entails, which helps to identify the real problem that is under study and needs an immediate solution. Now, in problem analysis, after that, after defining the problem, when we analyze the problem, to analysis how the problem affects the researcher, his or her current situation, and other people involved in the situation. The gravity of the problem and all the factors that are contributing to the problem are determined. The next, in generating possible solutions, focus must be on identifying and generating all the possible solutions for the problem. Each potential idea for the solution of problem must be considered without discarding it through value judgment. Now, possible solution, how we are going to solve the problem. When we have got the best possible solution, we will analyze the solution such as using the various factors about each of the potential solutions are investigated wherein all the positive and negative aspects of each solution are analyzed. Positive and negative aspect means the pros and the cons there of each solution are analyzed. After that, selecting the best solution, an attempt is made to compare the available solutions and eventually the best solution is selected based on the careful judgment. And the final step of the problem solving process is to practically solve the problem by implementing the selected solutions. Then evaluation and revision. After implementation of the most potential solution, an evaluation is made by judging the effectiveness of the solution in resolving the problem. Now, evaluation and revision also helps to redefine the problem and revise the problem solving process in case the initial solution fails to manage the problem effectively. So, while doing evaluation and revision, we can also redefine the problem and find out the best solution for the problem effectively. Okay, so this was my session, madam, and all the respected participants who had joined this. Yeah, thank you very much.
All the participants, if you have any question, you can, the platform is open for you. All the participants are requested. Any doubt, any queries? If you have any doubt, any queries, you can put in the chat box also. I think, sir, all the participants are very clear with the topic. Sir has explained in detail each and every topic. So they are very clear about the topic because they don't have any doubt or any queries. Okay, thank you so much, sir. Sir, you have explained in detail each and every point.
Yeah, yeah. Thank you, madam, for your patience and all the
Okay.
participants for your patient listening. And I hope all your doubts are cleared about coping strategies and problem solving. Thank you very much, madam, and all my dear participants.
Okay, thank you, sir. Thank you so much, sir.
Okay. Thank you, madam.
Okay, sir. So the next session for our today is the most important part is the case presentation. Today we are with us Priya Nandini Kohli. She is working in Bharti Hospital for since from 2 years. She will be presenting a case. So I would like Nandini to start his case presentation.
Okay, ma'am.
I requested all the participants to share during the case presentation because most of the time, if we do any case presentation, all the participants are not involving in the case presentation. The most important part of our session is to discuss. Discussion is the most important part in this platform. So I hope all the participants will involve in the case presentation. Is my humble request to all the participants, please kindly involve in the case presentation. It will be not a lecture style, it will be mostly a discussion part. Yes, Nandini, you can start sharing your slide.
Yes, ma'am. Ma'am, I'm not able to share my screen.
Albino sir. Sir, can you make please Dandini host?
Yes, ma'am, access given.
Yes. Nandini, you can share your screen.
Yes, sir.
Ah.
It is visible to all?
No, we cannot see your slide.
नंदिनी
Yes.
नाही अजून स्क्रीन शेअर नाही झालेली. स्क्रीन शेअर कर एकदा तुझ्या मोबाईल मध्ये. हा ओके, आता तुझी स्क्रीन शेअर झाली, तू चालू कर.
Okay, sir.
हा पीपीटी ओपन कर.
Good afternoon, ma'am. Good afternoon, sir. Good afternoon, everyone. Myself, Nandini Kohli. Today, my case presentation it is about schizoaffective disorder. My case is Mr. X, age is 54 years old, male, client, admitted in the hospital. His marital status is divorced. He is educated up to BCom final year, belonging from the Hindu middle class family. He is having known case of schizoaffective disorder. As per the information, the client birth as and early development was normal, and the his achievement all development milestones and right time. From his school time onwards, he was an introverted person, and he had only couple of friends. He was an average student in his studies. At the age of 10, he had an epilepsy attack. After that onward, he was observed with low mood and he was not ready to interact with anyone. But he continued his study and he joined for BCom. But he didn't complete after that. At the age of 28 years, he started on small business, but he didn't take cash properly from the customer. After that, he solved showing the aggression towards his sister and having delusion of from his brother in brother-in-law. Yeah, he's delusion having like he is planning to finish him. uh, he is admitted in the hospital because he having the aggressive behavior, excessive talking, work impairment, drug complaint. uh, Definition: schizoaffective disorder is a chronic mental health condition characterized by symptoms of schizophrenia and symptoms of mood disorder. In the schizophrenia, it is characterized by the disturbance in thinking and the emotion, violation and faculties in the presence of clear consciousness. And the mood disorder, in that the patient having disturbance in the mood, and in that full or partial manic and the depressive syndromes are present. uh, Clinical feature, in the schizoaffective disorder, there are three types of schizoaffective disorder, depressive disorder and the manic and the both mixed type. Clinical features, in that first, delusions, having the false beliefs, hallucinations such as hearing voice or seeing things that are not there, impaired communication and speech such as being incoherent, impaired occupational, academic and social functioning, aggressive behavior, excessive talking, poor drug complaints and the grandiose idea. Anyone having any doubt regarding the schizoaffective disorder or the having any doubt about my case?
Yes, participant. If anyone have any doubt, please ask to the presenter. Otherwise, you can put in the chat box. If there is no doubt, the case presenter can continue with the presentation.
Okay, ma'am. Okay, we will move forward. In the management, there are two types of management can give the treatment to the patient. In that, the medication and the psychotherapy. In that medication, antipsychotic, antidepressant and the mood stabilizing medication is there. In the antipsychotic drugs, clozapine, olanzapine, paliperidone and the risperidone can given to the patient. In the next, we will see the psychotherapy. In that, the psychotherapy we give the therapy like individual therapy. It is a joint process between a therapist and a person in therapy. Common goal of individual therapy can be inspire change for or improve the quality of life of the client. In that, cognitive behavioral therapy, it is a psychosocial intervention that aim to reduce the symptoms of various mental health condition, primarily depression and the anxiety disorder. Next is the family therapy. In that, we can see the improvement of relationship among the family members. And the group therapy, we give the some task to the client and express their feeling in that in the group. in the life skills training, social skills training, vocational rehabilitation, and the supported employment. In the hospitalization during crisis periods or times of severe symptoms, hospitalization may be necessary to ensure safety, proper nutrition, adequate sleep, and the basic personal care and cleanliness. Everyone understood?
Yes.
In that we after all therapy if not work, then we give the ECT to the patient to treatment that involves sending an electric current through the brain. This causes the means electric activity within the brain. If the patient having the seizures, that time we also give the ECT. Thank you. Everyone understood? Or anyone?
Yes, any question from the participant? Any doubt, any question? Yes, any question from the participant? There is no question from the participant. She has presented a case on schizoaffective disorder. Yes, am I right? Schizoaffective disorder.
Yes, ma'am.
So a patient who's admitted in the hospital diagnosed with schizoaffective disorder. What is the role of a nurse? As a nurse, we have what we are supposed to do.
नंदिनी स्क्रीन शेयर ऑफ कर दो.
So anyone from the participant can give answer. What is the role of a nurse? Sadija, can you give the answer? Yes, anyone from the group? No one? Okay, I hope all the participant had understood, has clearly understand about the topic regarding the coping mechanism and regarding the schizoaffective disorder. Thank you so much, Nandini, for giving a nice case presentation. If the participants are active in the case presentation, it will be more effective for our session. So I hope in the next session, it should be mostly an interaction session. Albino, sir?